Welcome to the program now. Quentin Whitwell, chairman of the board and co-owner of the Panola Medical Center. Hey, Quentin, how's it going, man?
Gerard, it's good to see you, my friend.
Yes, sir. Glad you could join us today to talk about something that certainly is on the mind of most, if not all, Mississippians. I know it's on the mind of all those folks down there at the Capitol, and that's health care. And in fact, it's a national issue. It has been thrust into the limelight. There are so many dynamics involved in the industry, and certainly the COVID pandemic was somewhat transformational for a good part of the industry as well, kind of a before and after observation of that. But most recently, Governor Reeves, as you are well aware, has submitted a proposal, the Reeves administration, to Medicaid, to federal CMS, to talk about increasing reimbursements to the state under the existing Medicaid program. It would amount to some $700 million at the gross level, and the state's share of that, the matching portion, would be funded with some fees that would be levied on hospitals that would receive these additional funds under this program. First, just get your thoughts overall about the program and how you may benefit from it, if at all.
Sure. Well, I've said before, and I'll say again, if I was in the oil and gas industry and I had a proposal that we could self-fund something that would then turn into more money and leverage it, that anybody would do it. And why it isn't being done in healthcare, I don't know. It really speaks to the disparities in coverages that a lot of people have. And I feel very passionate about making sure that all of our citizens in Mississippi are served and served well. And I'm very thankful that our hospitals do such a great job of taking care of patients, even when they're indigent and uninsured. In this instance, I am very thankful for the governor for following this program for the enhancement. I think that the enhancement is a good thing. A lot of the federal monies that we would have been eligible for many, many years ago are not as extensive as they used to be. I haven't analyzed his formula to know if that impact is exactly the way it is, and I think a lot of it's based on volumes of anticipation of what you've had in the past. So like a hospital like Greenwood, LaFleur, for example, I don't think it's going to get nearly as much money because they don't have nearly as many services as
Right.
they did back then. So from my perspective, getting the enhanced money, should we do it? Am I glad he did it? Yes, I'm very thankful. I support it. I hope it happens. I do believe, though, if I'm the feds, I'm probably saying, okay, well, wait a minute, you're wanting your cake, but you want to eat it too, because you're not expanding for the population and the actual persons that need the insurance. And so why would we allow you to take and not give? And so I wouldn't be surprised if we don't end up in a situation where we have to look at both in the legislature this year before it's over with. But we'll see.
So, Quentin, are you suggesting that it's possible that when CMS reviews the state's proposal, they come back and say, hey, we'll approve this thing if you expand Medicaid, add the coverage group of able-bodied adults to your existing Medicaid program? Do you think that's a possibility?
I do.
Yeah. Yeah. And you make a good point, and something we've talked about on the show. No, I appreciate your candor, and I know you deal with this every day. But we should point out that this is simply a request to use some existing regulations, essentially, existing law, to allow the state to receive a higher reimbursement, an enhanced reimbursement on the existing coverage groups that we operate in our Medicaid program. That's essentially what this is, and Medicaid, as we point out, is a joint matching program. The state has to pick up a part of it, and in this case, that would be covered through through fees, essentially, that would come from the hospitals that would receive this additional money. The other thing, before I let you comment, is we have to consider, do we not, that our disproportionate share payments may decrease as a result of this, right? So we have kind of a gross and a net.
Yes, no, I agree with that, and that's the funny thing is that the Lord giveth and the Lord taketh away, right? And so every time you look at well, we're going to pick this up, but then we're going to lose it, and it's a complicated formula. I just wanted to throw that out there a little bit provocatively, Gerard, just because I think that both sides of the equation are going to have to be looked at, and I think that CMS, as a federal entity that relinquishes the funds for our hospitals, is going to want to make sure that we're a fully honest broker in what we're doing and what we're applying for. That's all I'm saying on that. Now I'm going to say this, and I'll add this component. We have been very bullish about the new rural emergency hospital model, which has a subsidy direct from the feds every year, and really improves outpatient services in hospitals that really are declining on the inpatient side anyway.
Yeah.
It's not for everybody or for every hospital, but it does also have some detractions, like your Jerry psych unit cannot be attached. And there are other things. And so we're asking the legislature this year to look at some legislation related to the utilization of the former inpatient facilities in the hospitals that have converted to rural emergency. And so I wanted to bring your audience up to speed about rural emergency hospitals and the fact that they're of benefit. I was fortunate to be the very first one in the country in a role that I play as CEO at the Irwin County Hospital in Georgia. And then we did the second one in the country, and now we've done 6, and we're about to do 2 more. So, and this spans from Georgia to Arkansas, including Mississippi and Alabama. So, I think that's going to be something to look at in the legislature, is making sure we clear up what REHs can and cannot do, and our CON laws as it relates to that. I think that I hope that CMS will respond to the governor quickly while we're in the session, so that the legislature can look at any cleanups or tweaks that they might need to make. And I just want to say, I'm here in Nashville on meetings, but it's always good to see you in Oxford when you sneak in, and I appreciate you having me on your show, and look forward to any future dialogue about what we're trying to accomplish. I mean, these people in rural areas deserve really good care, and they I just never thought I'd be in a place in the state of Mississippi that is so rural, where I felt like rural areas were the ones just getting the beat down. And I hope that changes over the course of this next cycle of with our new leaders and elected officials.
And you're probably aware, Quentin, that our urban facilities aren't faring very well either. I mean, they're experiencing difficult economic times. Some are flat out losing money. I've looked at their financial statements, discussed it on the program, and talked to them about it. So it's that we have a very low commercial reimbursement rate as well, which most states sort of rely on that to offset the very low reimbursement rates of Medicaid and Medicare. And even if our Medicaid gets up to, under this program, potentially level or just below commercial reimbursement rate, that's still a very low rate relative to the rest of the country.
Yeah, no, you're right. And unfortunately, of course, not just in Mississippi, but in Mississippi for sure, between the pre-authorizations and all of the attempts to deny coverage, and then the retreat essentially to the Medicare fee schedule of the commercial payers, they don't look much different.
Yeah.
And of course we've been very frustrated with the Medicare Advantage plans too. So that's a whole other conversation for another day.
I know.
But thank you, Gerard.
I know. Quentin, appreciate it, man. Appreciate you coming on, and we got to get you back on. I look forward to talking to you more about this. And you're right. I think the legislature is going to be discussing health care and the industry in our state for sure. We got to. Appreciate it, Quentin. Thanks, man.
Thank you.
We're coming right back, folks, in the Element Well